Hey everyone, my name is Marissa Mazzari and I'm an office assistant for Improve Life. Today we are going to be talking about mandated reporting and how it varies among states in terms of who mandated reporters are, what they are required to report, who can involuntarily hospitalize someone, and the legal facts regarding involuntary hospitalization.
In both Oregon and Idaho, the mandated reporters that are allowed to recommend involuntary inpatient psychiatry are board licensees, certified healthcare facilities, the Oregon Medical Association, the osteopathic physicians and surgeons, primary insurers, and self-insured health maintenance organizations. They must report arrests, convictions, adverse actions, official actions, voluntary actions under investigation, prohibited or unprofessional conduct, medically incompetent or physical incapacity, and retirement from practice. In Oregon, only a doctor or community mental health program director can order a person to be held involuntarily in a hospital. In Idaho, in addition to the doctors and mental health program directors, physician medical staff members or physician assistants can involuntarily hospitalize someone for up to 24 hours. The name of this process is known as civil commitment, which is the legal process of involuntary psychiatry. Some legal facts include a legal process where a judge decides whether a person should be forced to accept mental health treatment can be up to 180 days or 1 year if they have intellectual disabilities. This applies to both Oregon and Idaho. Idaho also contains 2 involuntary hold processes, a 24-hour mental health hold or a 72-hour administrative process.
In New York, mandated reporters of suspected child abuse include health professionals, counselors, therapists, police officers, and social workers. Under the mental hygiene law, a patient may be involuntarily hospitalized by a family member, psychiatrist, social worker, or officer. Depending on the emergency, a psychiatrist must examine the patient within 24 to 72 hours after they are admitted. The patient may also request a court hearing.
So in Alaska, mandated reporters include teachers, social workers, law enforcement, mental health professionals, and healthcare providers. They are required to report if someone appears to be a danger to themselves or others if they suspect abuse. In Alaska, police officers, physicians, and certain mental health professionals are authorized to initiate a protective hold if they deem someone to be at immediate risk of harm. So this process is called a protective hold, and it can last up to 72 hours. During this time, the individual must be taken to a psychiatric or mental health facility for evaluation. If further hospitalization is needed, a judge must review the case to approve any extension beyond the initial hold period. The sources I used were the Alaska Department of Health and Social Services website and the National Alliance of Mental Illness Alaska Chapter's website.
In Maryland, mandated reporters of suspected child abuse include healthcare practitioners, law enforcement officials, social workers, and educators. To involuntarily hospitalize one under the civil commitment law, certification from at least 2 medical professionals must be obtained showing a mental health disorder. Within 72 hours of being brought to the hospital, there must be a mandatory review by a trained health professional to either release the patient or give them an administrative hearing within 10 days to determine if they must remain at the hospital.
So in Hawaii, mandated reporters include physicians, mental health providers, police officers, and some healthcare providers. They are required by law to report situations where they believe someone may be at immediate risk of self-harm, harming others, or where abuse is suspected. In Hawaii, mental health professionals and police officers have the legal authority to initiate an emergency hold for someone they believe may be at risk. This process is known as emergency examination and hospitalization in Hawaii. The initial hold period is 48 hours, which can be extended if necessary. The individual is typically taken to a state-licensed psychiatric facility, and if continued hospitalization is required, the person must appear before a judge to determine whether the hold should be extended. The sources I used were the Hawaii State Department of Health website and the National Alliance of Mental Illness Hawaii Chapter's website. So in Texas, mandated reporters include healthcare providers like doctors and nurses, mental health professionals, and law enforcement officers. They're legally required to report any cases where someone may be a danger to themselves or others, especially if they suspect abuse, neglect, or immediate risk of suicide. In Texas, physicians, licensed mental health professionals, and police officers have the authority to initiate an emergency detention if they believe someone poses an immediate risk. This process is officially called emergency detention in Texas. Emergency detentions in Texas typically allow a maximum hold of 48 hours, during which the individual must be assessed by a mental health professional. They're often taken to a licensed mental health facility, and the judge may be involved if the detention needs to be extended, and the individual has the right to legal representation during this process. And the sources I used were the Texas Health and Human Services website and the National Alliance of Mental Illness Texas chapter.
In South Carolina, healthcare workers, teachers, and law enforcement are mandated reporters because they must report any suspicion of abuse or danger to self or others, according to the South Carolina Code of Laws. The only people that can involuntarily hospitalize someone is a licensed physician or a psychologist. The name for this process is called emergency commitment. Psychiatric hold only lasts up to 72 hours, in which a judge has to review the case. Similarly to South Carolina, West Virginia healthcare workers, law enforcement, and teachers are mandated reporters, so they must report any suspicion of abuse or danger to oneself or others, according to the West Virginia Code of Law. The only people that can involuntarily hospitalize someone is a licensed physician, psychologist, or a licensed clinical social worker. The name for this process is called involuntary commitment. The psychiatric hold also lasts up to 72 hours, during which a court hearing is required to determine the next steps using a judge.
Mandated reporters in Michigan include a variety of people in different professions. Some of them include physicians, dentists, social workers, teachers, nurses, school administrators, and members of clergy. They are required to report any signs of child abuse or child neglect. Involuntarily hospitalizing someone comes from court-mandated orders, but if somebody is worried about another person's mental health, they can fill out a petition, give it to the police, and the police can take that person to the hospital. The process to be involuntarily hospitalized is to first fill out a petition or an application, then a clinical certificate is obtained, and then a second clinical certificate is obtained, and finally there's a court hearing. Some additional facts include that a psychiatrist must examine a person who is being involuntarily hospitalized within 24 hours. Another fact is that when there's a mandated reporter that files an oral report by telephone, that person has to file a written report within 72 hours of the oral report being made. All of this information came from Michigan.gov. Mandated reporters in Ohio include a variety of different people in different professions, and some of them include nurses, teachers, counselors, social workers, therapists, and paraprofessionals. They are required to report any signs of child abuse or child neglect. In Ohio, there are two types of involuntary treatment. The first one is emergency hospitalization, and that can only be used by certain health professionals and law enforcement only when an emergency exists. The second type is judicial hospitalization, which can be used by anybody. Emergency hospitalization's process is first custody application for emergency admission, examination, and then a 3-day hold. Judicial hospitalization is first an affidavit of the mental illness, temporary detention orders, pre-screen investigation, a hearing, and then the treatment plan. Some additional facts include that a psychiatric evaluation must be done in 24 hours of admission. Another fact is that if a hospital doesn't discharge the patient after their evaluation, they have 3 days to file an application for civil commitment. All this information came from education.ohio.gov and the Ohio Legislative Service Commission. Thank you.
Hi everyone, my name is Vismaya Vasant, and in Oklahoma, according to the Rural Health website, the Division of Mental Health and Addiction, and the Oklahoma statutes, mandated reporting is required amongst healthcare providers, mental health professionals, teachers, and law enforcement officials, and they are required to report cases or suspected cases of abuse, neglect, and situations where a person is a threat to themselves or others around them. These law enforcement officers and licensed mental health professionals have the authority to initiate an involuntary hold on patients who are unable to care for themselves. This is called an emergency detention under Title 43A of the Oklahoma statutes. An initial emergency hold in Oklahoma can last up to 5 days, not including weekends or holidays, after which an assessment is conducted to see if further inpatient treatment is needed. And according to Oklahoma law, these individuals must be evaluated in a mental health facility. Thank you.
Involuntary hospitalization laws differ significantly by state when a patient poses a risk to themselves. Today I'll cover how this process works in Utah and Nevada. In Utah, mandated reporters include healthcare professionals, teachers, law enforcement officers, social workers, and mental health providers. They're required to report suspected child or elder abuse in any situations involving imminent harm to oneself or others. This is called the temporary emergency involuntary commitment process. In Utah, a patient may be held for an initial 24 hours for evaluation. If further treatment is required, they must undergo a judicial review for an extended hold. During this period, they are typically transported to a designated mental health facility equipped for such evaluations. In Nevada, the mandated reporters are similar to Utah's, including healthcare providers, social workers, school employees, and law enforcement. They're required to report abuse of harm involving children or elders or anyone potentially in danger of self-harm. Physicians, psychiatrists, psychologists, social workers, and law enforcement officers can initiate this process if a patient shows a clear threat of harm. This process is commonly referred to as the Legal 2000 in Nevada. Under this hold, a person can be held for up to 72 hours for a psychiatric evaluation. During this time, they're typically transferred to a licensed mental health facility, and if the longer stay is deemed necessary, a judicial review is mandatory for extending the hold beyond the initial 72 hours. My information comes from the Utah Department of Health, Nevada Revised Statutes, and local health authority guidelines. The main goal of both of these processes is to safeguard the individuals in crisis.
In the state of Virginia, mandated reporters are those who are required to report suspected abuse, neglect, and exploitation. These people may include people who are licensed to practice medicine, hospital workers, social workers, teachers, and more. The process of involuntary admissions is when a petitioner or family member can involuntarily hospitalize someone if the district court judge or special justice agrees. For this process to occur, a petition for involuntary admission for treatment form must be signed, and the psychiatric hold can be up to 72 hours. In the state of North Carolina, a mandated reporter is considered someone who is required to report abuse, neglect, and/or maltreatment. This may include any prison or institution who has just cause for suspicion. Involuntary commitments may be committed by the examining physician or psychologist, and this process involves a patient who must go to a 24-hour facility and then to a judge to be examined.
That was a ton of great information. Thank you so much to all the interns who participated, and I hope you guys learned a lot from watching this.